Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. And today, we have a special opportunity. We're joined by Dr. Zameer Pirani, who's going to talk to us today about pain management. Dr. Pirani is an interventional pain specialist and the medical director and co-founder of Toronto-based Afiya Spine and Pain Institute. He's also an anesthesiologist with the Scarborough Health Network in Ontario, Canada. Dr. Pirani attended medical school at the Royal College of Surgeons in Ireland. After medical school, he went on to complete anesthesia residency at Western University in Ontario. After graduation, Dr. Pirani pursued a 2-year chronic pain fellowship at the University of British Columbia, where he had many excellent mentors. Dr. Pirani has had the opportunity to work in a number of settings during his young career. He has a passion for multidisciplinary pain management and patient-centered care. He strives to make a meaningful difference in the lives of all of his patients. Dr. Pirani recently opened a second clinic in Hamilton, Ontario, and we're happy to have him with us here today. So, Dr. Pirani, thank you for joining us today on The Health Advocates. Tell us about your background going to medical school and what led you from medical school into the field of pain management.
Well, I actually went to medical school in Ireland at the Royal College of Surgeons, and that was a pretty transformative period for my life because I got to live in Europe for a long time, be in a very diverse medical school with people all around the world. And I didn't really know what I wanted to do in medical school when I finished. So I worked in the UK and Ireland for a few years, and I discovered anesthesia in the ICU, actually. So I actually did my residency at Western University in London, Ontario, a 5-year anesthesia program. And I wasn't sure about pain either, but it's part of a core rotation. So you have to do chronic pain. And I really got to see the complex patients that were waiting for good quality pain management. I got to see some of the waiting lists, identify some gaps in care. I had some wonderful mentors. And I think it's really important to say that the opioid crisis was at the forefront when I was doing my training. So there was a lot of discussions. There was a lot of media coverage about the opioid crisis, and I got to see it firsthand. And then one of the things that really compelled me and propelled me into chronic pain was I saw that there was 1 and 2 year waiting lists to be seen at the University of Western. They had one chronic pain program, which was excellent. But to see some of the specialists there, it took about 2 years sometimes to see them. So I thought in my head, where are all these patients going? That's kind of what propelled me to do chronic pain. And I haven't looked back, and I really enjoy what I do.
That's great. Can you tell us a little bit about your specialist-led image-guided pain treatment?
Yeah, so this is something that I'm extremely passionate about. So as I said to you before, that to see a specialist, it can take up to 1 to 2 years in our current system, especially in an academic center where there's a university teaching hospital. So when I identified specialist-led, I want patients to have rapid access to people with training that is recognized by the Royal College of Canada or other jurisdictions, for example, the United States, where physicians have specialist training, so additional training from their primary medical specialty in pain management. And I think that's really important because you are essentially able to identify all the complexities and use images such as fluoroscopy or X-ray guidance, as well as ultrasound or a combination of both. And I think that's what patients deserve, is to having those directed interventions that can help them move along in their journey with pain.
Yeah. And what has been the reaction from patients that you've been seeing to these methods?
Well, I think there's been an overwhelming, so pain is very complex. I always say it's can be like Pandora's box, and not one shoe doesn't always fit all. So it requires someone with additional training, with expertise to actually identify some of these issues that the patients are having. But when you see patients that are coming from some of the other community clinics where I work, they're outstanded by the quality of the interventions, the quality of care, the amount of investment that physicians have made in themselves and in their patients and the people around them to actually deliver high quality care. So being able to identify exactly the nerve that's being involved in their, let's say, chronic leg and low back pain, right? That is a high magnitude of difference in patients' journey with chronic pain.
What are some of the barriers that patients suffering from pain contend with?
So part of it is, and then I think it's quite, and especially I'm speaking in Ontario because I work in Ontario, is that you need a referral to see someone like me and to see my colleagues. A lot of patients don't have family physicians, or if they do have family physicians, there's a long waiting list to see their family physician, or they're relying solely on walk-in clinics, or they're in so much pain and so much disability that they just isolate themselves at home. Part of the apprehension for our primary care providers, which are essential to our healthcare system, is that they just want to have their patients seen, I should say. So sometimes they feel it's a specialist clinic. Maybe the waiting list will be 6 months to a year. And really what I've done is, even my clinic's been open over 2 years now, and we're still seeing patients within 2 weeks. So I think the major barrier is the referral process to see us. And also awareness is also a barrier. There's a lot of bad reputation with certain pain clinics, certain primary care physicians, things that patients are just going to be put on medications and opioids and things like that, and caution some of their patients. So I think we need to really improve the patient journey, improve the patient process, and create awareness for not only healthcare providers, but the public in general, I should say.
Yeah, no, that makes sense. What about opioids? A lot of the patients you see taking opioids, or how does that play into it?
Well, I have such a complex, diverse group of patients that are referred to us. For example, I might have someone who just has a sports injury and they're young and fit and they're athletic, so they're not on opioids. But I see some chronic complex pain, or patients have had pain for 10, 20, 30 years, and they were unfortunately put on an opioid a long time ago. And so they're chronically dependent on opioids. So I have a variety of patients. And so our practice is generally not to start opioids. There are certain exceptions, but we give patients additional options and a whole spectrum of care that can be what we call opioid sparing, which I think is really, really important.
Interesting. What advice might you give to a patient suffering from pain, someone who's not in Ontario and that can come to your clinic? What advice generally would you give to patients suffering?
Well, I always say to my patients, regardless of their age, I always say to them that I believe you, even though we can't see your pain, because pain is a symptom, your pain is real. And then I always tell them that what I want to do in my initial consultation is give them hope. I want them to be hopeful for the future. Not every single shoe fits all, and that's really important. So we need to work together, have realistic expectations. I want to give them hope. I want my patients to have hope. And I want to say, we'll attack this one step at a time. We'll get you moving in the right direction. And I always kind of reframe them and motivate them and say, there's all these different modalities that we can discuss on how to get your pain better. Pain is part of your life right now, and it's part of your story, but it's not the whole story. So let's work together. Let's pace ourselves. Let's figure out where the pain's coming from, and let's have realistic expectations of the benefit and the progress we're going to make over time.
Do you incorporate things like physical therapy or acupuncture or general massage?
That's a great question, Stephen, and that's really essential to good chronic pain management. And that's why having specialists who have additional training and understand the intricacies of chronic pain management are delivering in the forefront of chronic pain management care. Because I always say to my patients, I actually dictate this in my notes, is that the 4 Ps of chronic pain management, and this includes the pharmacological aspect, so putting the patients on the right medications. Number 2 is a physiotherapy and rehabilitation, and that is so important. And they have to be on the appropriate rehabilitation and appropriate physiotherapy to actually get the best magnitude of pain difference. Their psychology has to be optimized, so getting them into cognitive behavioral therapy, mindfulness, meditation, getting them to believe in themselves. Our clinic actually has pain classes where they focus on the psychology in groups, and it's covered by the government. So that's wonderful for our patients. That's a wonderful service for our patients. And then lastly, there's procedures. And the procedures are actually only a small part of actually what we do. But if we can combine all those things together, Stephen, we can have such an excellent magnitude of difference in patients.
Yeah, that's great. Well, thank you so much, Dr. Pirani. This has been really elucidating for our patients. Before you go, last question, what changes have you seen in the healthcare system generally when it comes to pain management throughout your career?
Yeah, so I love this question because I want to be completely honest with you. And I'm only speaking for Ontario because this is where I work. And in Canada, the provinces have different healthcare models. And we're seeing a lot more specialists being graduated from the Royal College program. So we're seeing a lot of more specialists graduating from different universities across our country, which is excellent. Now, what we're not seeing more investment in community-based practices, where essentially the physician has to take on all the brunt of running these practices, and they can be very, very expensive. And I don't believe there's enough opportunities in academic hospitals to actually run a pain program at the level of care that is required to see patients rapidly within 1 to 2 weeks of one, as opposed to having 2-year waiting lists. So I'd like to see much more improvement with the system. And I think it's really important for physicians like myself and my colleagues and patients. Patients are really, really important to advocate, to invest in chronic pain management because it can happen to anyone. It doesn't discriminate your social economic status. It can happen to anyone. And so I really want to reiterate that to the people listening, that we need to canvass our politicians, our MPs, etc., that these models work if they're run by the right people, such as specialist-led care, as well as people that are involved with chronic pain and awareness that may not be physicians. So I think I'd like to see more investment. And I think when that happens, I think we can make a massive difference in patients' lives, and patients don't have to wait and they don't have to live in isolation.
Great. Well, thank you again so much, Dr. Pirani. Thank you for all that you do for patients suffering from pain. And thank you for joining us today on the Health Advocates.
Thanks for having me, Stephen. Appreciate it.
Well, once again, we thank Dr. Pirani for his time and all of his efforts that he's doing on behalf of patients. We hope that you learned something from today's episode and found it fascinating as I did. Thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.